Designing a building is a complex process, and it becomes more complex when it's in a healthcare setting or an oncology setting. And that's why it's important that we've been engaging with the clinical users and the patient reference groups to make sure we know everyone's requirements, desires and needs. One of the things we are focusing on is how patients get from one area to another. So it's important to think where they are located in the building and also how they get there. One example of this is how the inpatients will get from the ward down to perhaps the radiotherapy treatment. And we're really keen that that's as dignified as possible. And we're doing this by having private corridors from the bed lift down to radiotherapy, so that patients aren't going through public areas to get there. We're also really keen to get lots of light into the building, so it's a nice welcoming environment for patients, for visitors and of course staff. A really nice example is the terraces at the front of the building, which is a nice open space that people can go to and enjoy and get a breath of fresh air. So it's important that we make this space usable all year round. So we're working with the clinical use groups and also the patient reference groups to ensure that we meet everyone's requirements and needs.